Hello, good evening, everyone.
Good evening.
Thank you so much. So we are having our live webinar today for OET exam. And in this webinar, we will be having a discussion on two of the modules, which are writing and speaking module. So today's the topic of our webinar is mastering the writing and speaking modules and tips for first-time success. So I welcome you all in today's webinar. I'm Dr. Maryum OET mentor at MedExam Expert. I'm working as NCHD in obstetric and gynecology in health service executive in Republic of Ireland. And I'm also associated with AIPPS Ireland, and I'm working as media secretary. So let's start with our webinar today. We are going to start with the writing module first. So we know that the time allocation for writing is 45 minutes, and it is the third subtest of the OET exam. So 5 minutes are just for understanding and 40 minutes for the letter writing. So it exactly work like this. Like in the first 5 minutes, I used to advise like this, that you have to just focus on the task given. And then the next 40 minutes are for your letter writing. So in that 5 minutes, you would be able to categorize the type of letter, that what is the type of letter. Either it is a simple referral letter, either it is a discharge letter, whatever the type is. So you have to focus on the task given in that 5 minutes. Then you have to start writing from address and salutation part, which is the first part of your letter writing. You have to start writing address and salutation. It is nothing more than copy pasting the information given in the case notes. So there is a pattern. You all can follow this pattern, that you have to mention the doctor's name and address. Then you have to write a date with one blank line, and then patient name and date of birth. And then you have to focus on your case notes. If you are done with address and salutation parts, it means you are done with your first part of letter writing. And after that, you can start writing the body of the letter. So in address and salutation part, please make sure that you are writing each and every detail correct, because it is already mentioned in the case notes. If still you are not writing the details correct, you will be at risk. So now comes the body of the letter. It should contain purpose, which should be written most appropriately. The thing is, a majority of students do fail in OET writing because they don't know how to write a good purpose, how to write appropriate purpose. And some of the times in OET letter writing, when students are in a struggle of, I'm sorry, when students are in struggle of knowing about OET letter writing, they can't understand that what is the purpose of OET letter writing. So it is a long debate. Of course, I don't know whether any of the participant here is our course student or not. So course students know that how we can write a beautiful purpose. So please make sure that whenever you are writing the body of the letter, your first thing is purpose of the letter. If your purpose is written accurate, then you surely score grade B if there is no other grammatical mistake and format is also correct. So the thing is, if your purpose is correct, regardless of the other thing, if there are any of the minor mistake in the letter which can be negligible, then the thing is, you can easily get grade B. So from this line or this statement, you can get an idea that how significant the purpose of OET letter writing is. After purpose, there should organization of case notes in paragraphs accordingly, and for your word count to be in a normal range, approximately 4 or 5 paragraphs are more than enough. Each paragraph must be having 3 to 4 lines. So this is ideally the formula for keeping your word count in normal range. And at end of the letter, you have to end your letter on yours sincerely or yours faithfully. Okay, so again, this depends, like in which scenarios you have to write yours sincerely and in which scenarios you have to write yours faithfully. So please make sure that you are not going to do any of the mistakes or any of the blunders. So Format of letter is very, very important thing, and it varies from letter to letter as there are 4 kinds of letter writing tasks. The thing is, we do know that how to write a simple referral letter, because on the internet, if you Google anything, it comes out. So the thing is, there is a lot of material on simple referral letter is already present on the Google. So students do think that if they are going to write a simple referral letter, they will be following the pattern. And if they are going to write an urgent referral letter, then they are doing the same thing. So here is the mistake. Every letter writing has different organization of paragraphs. It is called format of letter. We know that there are 4 kind of OET letters. Referral letters further subcategorized into simple and urgent, then discharge or update or transfer letter. So you can get any kind of letter in your real exam, and you have to decide which paragraph should be written at top or which paragraph should be written at end. So please make sure that you are not going to do that mistake. All 4 letters show somewhat different format of organization of paragraphs. It is essential to understand the proper format. Okay, so if you are writing simple referral letter, format must be different. If you are writing discharge letter, same format must be different. If you are going to follow the same format for every letter, you will be in trouble. Word count command should be followed strictly, as you may lose your marks if word count is not within the range given. If you are writing a very good letter, your letter is following all the aspects, like purpose is there, everything is there, there is no grammatical mistake, but still your word count is not in the normal range which is given, which is 180 to 200 words, then definitely you will be put at risk of not passing your exam. So there are some of the challenges which aspirants do face while writing letter in OET exam. So we have to discuss some of these here. Lack of understanding of letter writing. So what does it mean? A lot of aspirants don't know how to write a letter. What are the contents of a good letter and how to write it into paragraphs. They use the note form as given in the case notes and sometimes copy paste the information given, which results in their failure. So the thing is, we do understand that it is challenging one, but it is the most doable part of OET exam. But the thing is, without proper knowledge, without proper guidance, you can't ace this module. So the thing is, you have to be properly oriented and properly guided by any of the mentor or any of the source of knowledge, whatever you want to take. But you must be ready for taking your exam. Lack of knowledge to implement. Aspirants do not know how to use good words, sentence formation, organization and layout, gender and style, language, grammar, and tenses. Okay, so some of the time students do think that, okay, I'm going to use a very fancy English, my vocabulary is so high, so I'm going to write like this. So you have to make sure that what are the requirements of OET exam, what examiners are wanting from you. So if you are not ready for this thing, then definitely you can't perform anything good. But if you are properly oriented, if you are properly guided, then definitely you would be doing your best. Another challenge is unable to do time management. This is another important factor, because some of the times students do what? They used to spend whole time like what I would be writing. They are making a sketch, like rough sketch in their mind or on the paper. And when it is time to deliver all the knowledge on the real sheets, they are in a trouble, because the thing is, then they lost all the time. So time management is another problem while writing a letter. Students waste a lot of time on thinking what should be written in the letter, and time goes off. So this is another dilemma. The thing is, when you are writing rough, whatever the sketch you are drawing for your own information and whatever the things you are thinking that you are going to write, please make sure that it is not, the time allocation is not that much. Like if you are going to write 2 of the letters, 1 rough and 1 clean, be very smart in doing time management, because the thing is, 40 minutes are not that sufficient for a letter writing. So please make sure that you are ready for it and you have a rough sketch in your mind, and then you deliver that one on your paper, which is your answer booklet. If they are able to write a good start, then due to lack of time, they don't perform very well in the end. So for those students who used to waste a lot of time in thinking and all, even if they start very good, still they can't complete the letter, and this will result in their failure. So this is the thing. So here are some of the journal writing tips for OET letter writing. So practice at least 30 letters before your real exam. So the thing is, if you don't know anything about OET exam, if you haven't practiced any of the letter, ideal scenario is you have to write 30 letters before appearing in the real exam. The thing is, make sure that you are writing with timer on, because the thing is, it will make you prepare for your real exam. If you are writing rough at home and you are not bothering for the time management, then definitely it will give you a tough time in the exam as well. So please make sure that whenever you are writing at home, you must be having timer on with you for 40 minutes so that you would be able to manage time in real exam as well. After writing each letter, get it checked from a credible source, get feedback of your letters, and rectify your mistakes. This is an important point. Most of the aspirants do what? They used to write a letter, pick out their mistakes by their own, and then they are standing nowhere. They don't know what they have did in the letter. So the thing is, please make sure that you are writing a letter, get it checked from a credible source, and then whatever the mistakes mentor found your letter, you have to rectify your mistakes. So learn from your mistakes and improve. If you feel that you are struggling regarding OET writing, please do not hesitate to ask for help. This is not only for the writing. If you think that you are struggling in any of the OET module, please do ask for help, because you are investing such a huge amount on your exam, on your course preparation. So please make sure that you are not lacking anywhere in any of the module. It's better to seek help than appearing in OET again. Do not write rough, only focus on your original letter. So when you know the format of the letter, it is easy to solve any kind of letter writing task. The thing is, in OET letter writing, only the format of the letter is the thing which differentiates all the 4 kinds of letter. Once you understand all the 4 kinds, then definitely you are in a good hand, and you can easily write any kind of letter just by categorizing on the exam day that, oh, it is a simple referral letter, so I need to write this paragraph at the top and this at the end. And then for any kind of letter writing task, you can easily decide. So letter assessment is done upon many aspects like accuracy, coherence, word count, English grammar, and neatness, etc. So you have to be particular about these all. So again, if there is any course student, he or she might be knowing well that whenever there is a letter in which there is a lot of overwriting or cutting, their score or grade is somewhat less than the other student who is writing neat. So please make sure that this is another important factor of your letter assessment. You have to write very neat, and there should be no cutting and overwriting. Every letter has its own trick to compile case notes, and it is easy to pick them out. If you may know all the essential of the letter writing, then it must be the most doable part for you, and it can only be done with the help of proper guidance and course, definitely. So just for the ease of understanding, I'm going to show you the OET writing scoring criteria. How many points you need to score grade B in OET letter writing. So total marks you can get is 38 points. You need to score the following for grade B. If your purpose is containing 2 out of 3, you will surely get grade B if rest of the letter is even satisfactory and there is some of the minor mistake or there is no grammatical mistake. But if it is having a lot of blunders or a lot of mistakes, and definitely, even while scoring 2 out of 3 in the purpose, you can't get grade B. So if you are scoring a marks like these, like in purpose, it should be 2 out of 3. Then in content, you have to score 5 out of 7. For clarity, it should be 5 out of 7. Gender and style, 5 out of 7. Organization and layout, again, it contains 7 marks. Language, again, 7 marks. So total is 38. And you have to score 27 out of 38 for getting grade B, which is 350 out of 500, which is OET scoring criteria. So this is the letter writing scoring criteria. You have to be very particular about all of these factors which I have mentioned. If you are going to score like this, definitely you can get grade B. So writing assessment criteria, what are the things which you should be very particular about? The purpose, it should be easily and immediately identifiable for the reader, so there is no search for it. The thing is, if examiner is looking here and there that where is the purpose of letter is, they don't even bother to read the rest of the letter. So please make sure that your purpose must be identifiable by the examiner, and it should be written at the top. If there is no purpose in the letter, nobody is going to check your letter. The content key information is included, no important detail is missing. Then when you are summarizing the paragraphs, like the symptomatic history of the patient, make sure that all the key information must be included in the content, and no important information must be missing, and no irrelevant information should be included. Some of the time students do think that, okay, my word count is not in the normal range, I can add this line as well, but that is totally irrelevant. Then what happens? It will result in your failure if you are writing irrelevant in OET exam. Then appropriateness of your letter based on your reader. Your tone should be professional and appropriate to the document's purpose and audience. So the thing is, please make sure that you are writing appropriate things. Some of the times I used to go through the letters in which in the case notes there is simple English, but the students have modified in their own language. So I wonder that why they do this blunder. The thing is, always write simple and clear English, whichever is present in the case notes. It is the test of your language exam, they are not checking your medical knowledge. So please make sure that whatever the disease and the symptom is given, keep it the same. If you are going to make a diagnosis by your own, then definitely you will be at risk. The organization and layout key information is highlighted and subsections are well organized, such as the reader can retrieve information quickly and easily. Your organization must be very beautiful so that the reader can easily pick out the information that what you are trying to say. And then there comes the language, which means spelling, punctuation, vocabulary. There must be no grammatical mistakes. Sentence formation should be very beautiful. So now we have done with the writing part. Now we are going to start. If you guys have any question, you can write it down. I will answer all the queries very shortly once I finish the speaking part as well. So please make sure that nobody is going to miss any of the question. So OET speaking, I'm going to give a brief overview of the criteria and the speaking module as well. So what happens in OET speaking? You complete 2 role plays with interlocutor, and you play the role of your profession. For example, nurse, doctor, physio, whatever you are, you have to play your role, and the interlocutor plays the role of your patient or their carer. So you are given all the information you need on a role play card, and you have 3 minutes per role play to prepare. So the thing is, on the exam day, when you are appearing in the OET speaking, you will be having the scenario like you must be in the room with the interlocutor, who will be playing the part of your patient or a carer, and you will be playing your own profession. So you will be given 2 role play cards, and you will be given a card in front of you everything must be written on there, and you have 3 minutes to per role to prepare yourself. No, not only in this more comfortable scenario for you as a healthcare worker, but it is also means that you, as you are preparing for the test, as you are improving the language and clinical skills of your future workplace. So it is not just the test. If you pass this exam and if you reach to your desired destination, any of the English speaking country, then definitely you are improving the language and the clinical skills for your future reference. So how you are scored in OET speaking. Your role plays are recorded and assessed by at least 2 trained OET assessors. They rate your speaking performance using linguistic and clinical communication criteria. So the thing is, you will be assessed upon 2 things, which is language and clinical communication. So linguistic criteria, total marks 6 for each factor. Okay, so there are the factors which includes intelligibility, fluency, and appropriateness of language. And other thing is resources of grammar and expression. So here are 4 factors, and there are 6 marks for every factor. So in total, there are 24 marks for linguistic criteria. So what does intelligibility means? This means being able to speak clearly so others can understand you. You need to pronounce words and sounds clearly, use the right tone of voice, and use stress and rhythm in your sentences. Then there comes fluency. This means speaking smoothly and at the right speed. You should not speak too fast or too slow, and you should not pause too much or hesitate when you speak. This is the most important thing because a lot of aspirants do hesitate while appearing in the exam. So I know that this is very common and it happens with every one of us. But the thing is, you have to prepare yourself. Ideal practices, if you are shy enough, if you are hesitant enough and you can't practice with any of the mentor or any of your friend, ideal scenario is lock your room, practice in front of a mirror. Because students do shy in front of the mirror as well. Students do think that it is kind of shame if we are not speaking English very well. The thing is, it is not a kind of shame. Please, first of all, clear your mind. It is not a shame for anybody of us if we can't speak English, because people who live in English speaking country can't speak our language as well. So it is a matter of language. It is a matter of ethnicity. So please make sure that you are not feeling this thing and this kind of shyness and all. So if you are not prepared enough, if you're shy enough, if you're hesitant enough, please make sure that your room is locked and you are practicing in front of a mirror. Then after a few days, develop some of the confidence and then start speaking with one of your fellows who is also appearing in the OET exam. Okay. And then advisable thing is, once you are prepared enough to talk good English in front of anybody, then you can book any of the mock exam with any of the mentor. So this is the ideal situation. Your speaking takes only 15 to 20 days for the whole preparation. So please make sure that you are preparing it very, very good. Now, there comes appropriateness of language. The criteria consider how you use the right words and tone for the situation and the patient. This means that if we know that we have to be very calm, we have to be talking in a very polite manner with the patient. But the thing is, sometimes there is a scenario in which you have to consult the patient, and patient is very difficult to be consulted. And aspirants do what they used to be very rude with the patient. Like they used to say that I am telling you from a long time that this is not beneficial thing for you, but still you are keep on saying me this. So please make sure that he or she is your patient. You have to be very polite. Okay, so they are basically testing you for this. Okay, whatever the scenario is, whatever the role play card is, you have to be very polite. Then there comes clinical communication criteria, and there are different factors for this as well, and there are 3 marks for every factor. First thing is relationship building. This means starting the conversation in a friendly and respectful way, listening carefully to the patient, not judging the patient, and showing understanding for the feelings and the situation. The thing is, you have to start building your relationship with the patient. If patient is speaking, let him speak, let her speak. Don't intervene the conversation. It will give an impression that, okay, the doctor is very keen on listening towards his patient. Understanding and incorporating the patient's perspective. This involves asking about and understanding the patient thoughts, worries, and expectations. If patient is in a stress and he or she is mentioning again and again that I am stressed and I'm worried, then apart from the role play card, you have to ask patient, okay, Mr. John, please tell me, what is your worry? Why are you so much concerned? I totally understand you. I'm your doctor. I'm here to help you. Sentences like these can help your patient and put him in ease. So please make sure that you are using the correct sentences at that time. So providing structure, this means organizing the conversation in a logical way, clearly indicating when you change the topic, and use techniques to make your explanation clear and organized. Another thing is information gathering. This is the best technique to apply actually for speaking role plays. The thing is, you have to ask patient first. If you are saying and declaring a diagnosis to the patient, first ask the patient, Mr. John, I'm having your reports. You are having this disease. So what information you know about? Like, what is the information patient is having about the disease? So then you have to ask the patient story, asking open question at first, and then more specific question, not asking confusing or leading questions, and summarizing the information to check for understanding. And then at the end, you have to give information. First, you have to gather information, and then you have to give correct information. This involves finding out what the patient already knows, pausing when giving information to check for understanding, and encouraging the patient to share their reactions or feeling, checking if patient has understood the information, and finding out what do students do. They used to give the information whatever is written in the bullet point, and then they keep on saying and completing their bullet points. It is not a matter of completing your role play. If you are not completing your role play in the given time and still your 2 or 3 bullet points are left, still you can ace this module. The thing is, you have to make sure that your patient is satisfied. Okay, once you deliver one of the bullet point, make sure that your patient has understood each and everything. You have to ask, okay, Mr. John, am I understandable to you? Are you getting me? Some of the sentences like these, you have to use these sentences so that it may give you an idea that your patient have understood all the information. Okay, so now we are going to proceed towards question answer sessions, and you can ask any of the question you want.
Assalamu alaikum, ma'am.
Walaikum assalam.
Actually, I have a question regarding writing task. That when we choose the relevant content, mostly regarding past medical history, so we usually eliminate mostly can't select the relevant content. So how can we avoid these mistakes? Like we are going to miss most of the relevant content.
It is just a matter of practice. Once you are competent enough, and if you are done with the number of letters which I have told you, it would be very easy for you to picking out only the relevant information. But when you are not prepared enough, then questions like these arise that students do ask, that how can I find a relevant information? So keep on writing and get your letter assessed, then definitely there will be no trouble for you.
Yes, okay, ma'am. But actually, I have a little bit confusion regarding these. So, if you can a little bit emphasize upon like father history or medical history, in which you usually write about, like if you are going to write regarding gastroenterologist, then most of the history is regarding is we can't write is irrelevant, I can say like this.
So if you think that in the past medical history or personal history there is nothing, you can totally skip it.
Okay. And sometimes we write something irrelevant, which usually irritate the examiner, as you have told in this whole lecture. So this is what I'm going to want to ask.
I'm not getting you. You are asking like, if you think that that thing is irrelevant, then what's the reason of writing that thing?
Sometimes I usually do this, like in today's lecture, today's
Yes,
task is.
I'm telling the same thing. If you do the same thing like you are writing irrelevant, then definitely you will lose your marks. So make sure that if it is not related to patient current symptom, patient current history, please do skip that part.
Okay, I got it. Thank you.
You're welcome. Any other question?
Ma'am.
Is there any other question?
Yes, sure, ma'am. Can I ask?
Yes, please.
Ma'am, I have some difficulty about writing purpose because when I read the paragraph whole scenario, then it's quite difficult to get to recognize the purpose. So can you tell me? Could you tell me how we could recognize the purpose of the letter quickly? Because I feel very bad when I couldn't find the purpose of letter.
Mm-hmm. So it is very easy. You just have to write the main thing, like why you are writing this letter. This means the purpose of your letter. But the thing is, you have to write purpose appropriately. If your purpose is not written appropriately, then you will be in trouble. So, first of all, it is you who have to think out like what is the purpose of my letter? Why I am writing this letter to this person? So now I think it would be very easy for you to understand that how you will be going to summarize your purpose.
Okay, thank you, ma'am. But sometimes, ma'am, it's quite difficult to find out the purpose of the letter because the purpose, this is the main thing is purpose. If your purpose is clear, then you can easily write on the letter, whole letter. So sometimes I feel difficult like this.
Are
That's
you
why
our course student?
yeah.
Uh, in which month you were joining our course?
No, your I'm going to study by myself.
Okay, so the thing is, if you are struggling with any of the part of writing module, I would advise to take our course.
Okay, ma'am. Thank you. God bless you, ma'am.
Thank you.
Hi, ma'am. I have a question for you.
Yes, please.
Basically, yeah, the questions regarding the purpose. So, the purpose is basically the task that we are assigned to. Do we look for the purpose on the task directly, or do we need to go to the
No, it is not like that. Like there is a purpose written somewhere between and you have to copy paste it. It is you who have to struggle something. Like there is a
Okay.
struggle to achieve something. So it is you who have to decide, like, okay, this is my task. Now what I am going to write in the purpose of the letter. The simple
Okay.
you have to rule out why I am writing this letter.
Okay.
Once you get an answer of that why, then definitely you can write a beautiful purpose.
All right. Okay. So I just want to ask about the courses as well because I don't know. That's the random WhatsApp group. Somebody added me, so I don't know.
Okay, so I think Faizan has shared our link or the number of the course coordinator. You can talk to him for be a part of our course, and our course is going to start next week.
All right, next week. So do we need to take like 1 month course or I mean I don't know how it works. So
yes, we have 1 month course, and for every module we have 4 live sessions. I am a writing mentor, so being a writing mentor, I can tell you for the writing aspect as well. So we have 4 live sessions and like with a week apart, and we have a session as well as we have live letter assessment.
All right. Okay, that's fine. Thank you very much.
Thank you.
Thanks.
So, any other question? Okay, so
Assalamualaikum, ma'am.
Walaikum Assalam.
Ma'am, I have a question. Can you please tell me how to differentiate between a normal referral letter and urgent referral letter? Sometimes I get confused about it.
Okay, so the thing is, you have to decide upon symptoms. You have to decide upon scenario. I told you that OET letter are being differentiated upon format of the letter. So it is you who have to decide if you think that there is no emergency situation, there is no urgency in the letter, you can easily categorize that letter as simple referral letter. But if there is emergency situation, then definitely it is urgent referral letter. But I would say attend our course, be a part of our course, so that you would be knowing that there are different things upon which we categorize letters on simple referral letter and urgent referral letter. And definitely I can't share it here just because it is a long debate.
Thank you so much, ma'am. I got it. Thank you.
You're welcome.
Hi, ma'am. I have another question. It's me again. Sorry.
Yes, please.
I just want to ask. So, do your courses work like the different modules? Like, because I don't have any problems in speaking. I don't have any problems in listening as well. So I just want to ask, do your course help me in one of the module? Like, I'm struggling with
Yes, you
reading and
can be a
writing.
part of any of the module. It's totally up to you.
All right. Okay. Thank you. Thank you very much.
Okay, so there are some of the queries in the comment box. Someone asked, beautiful sentence mean what? It means appropriate sentence with no grammatical mistake. Discuss one letter on that criteria. So, Dr. Umar Farooq, we are not discussing any of the letter here. If you want to discuss a letter, you can be a part of our course. You are more than welcome in our course. Hi, ma'am. I want to ask relevant history because I have difficulty in finding out accordingly. So, please emphasize upon one past medical history, especially. I think I have answered that query. Ma'am, can you please provide details regarding pattern of each type of letter? So, Dr. Javeria, I would say please be a part of our course so that you would be able to write any kind of letter. And yes, definitely, we can provide you a lot of stuff because in our course, once you are a part of a course, you will be provided with all the stuff and all the course material. Sometimes it is too difficult to recognize the purpose of the letter. So I have already answered this. So Fizan have shared our number, who is the course coordinator. So you guys can talk to him for your registration and all that thing. Ma'am, how much time takes to prepare for OET and how many hours daily? I am new. So Shanzia, I would say appropriately or approximately 1 to 1.5 months is more than enough for preparing OET exam. And for how many hours, it actually varies from person to person because some person do work, some don't. So the thing is, it depends on your I would say circumstances. If you're working, then definitely you have to manage time, but if you're not working, then it's totally up to you, like how many hours you can give it to this exam. But approximately 1.5 months is more than enough.
Hello, ma'am. I have a question for you.
Yes, please.
Sometimes there are two conditions mentioned in the case notes. Like I was just practicing and it was like two conditions, acute exacerbation was asthma and MI. Both were relevant and previous history was also positive for these two conditions. But as the case was too lengthy, so if I incorporate both diseases in my case note, it actually becomes 300, 350 words, which is much longer. So in that case, can we skip one condition and focus on one condition just? Is it possible, or we have to incorporate both
If
diseases
you
in
think
the
that
case notes?
if you think that by skipping one of the disease, you are okay to write all the important stuff, then good to go. But if you think that by skipping that disease, you are not in good hand, then definitely you are at risk. It is just a matter
Uh,
of practice. It is not a difficult thing. It is just a matter of practice, because it is most frequently asked question that how we can find a relevant stuff. So once you are practicing a letter, it would be very, very easy for you to find out the relevant stuff.
okay, thank you.
You're welcome. Okay, so I think I have answered all the queries as well. And hi, ma'am. Good evening. Thank you so much for your effort. Nowadays, they are telling that UK there is no vacancy. Is that true? Then if we completed OET exam, how we can approach the process? I would say please don't put your ear to any of the news. There is saturation, but we can't do anything about that. Just be very sorry. Put your faith in God, and I would say pray for your better future. Just pass this exam, and God will make way for you. So please don't be don't put your ears to any of the news like these. So good luck very well, and prepare your exam very well. If you need anything, like if you are a course student and if you need any of the guidance or anything, if you are having any query, you can contact our team. Our team provides a technical support for 24/7, so you can ask for any of the thing. And there is a study room. Once you are a part of a course, then definitely there is a study room in which all the mentors and the students are present, and if you are stuck at any point, you can ask for help at any level. Okay, so we do provide mock exam service as well. If you think that you are not for the course, you can prepare yourself and then you can be a part of mock exam just for your evaluation. So we do provide that service as well. Plus, we are having our free WhatsApp group in which one of the mentor do some random activities from Monday to Friday. Faizan will share the link of the group in the comment box, and you all can join that group for your betterment. So I think, please, do you think that OET exam is easier than IELTS? I'm struggling at Dr. Rula. I'm not comparing any of the exam here. It's up to you, whichever exam you want to take. IELTS is also good exam. OET is also good in its own way. So I'm not here for the comparison. But I would say if you belong to a medical background, I would advise take OET exam. So thank you so much everyone for your presence and good luck. Allah Hafiz.